The first neurons form the nucleus rubus. Nucleus rubus contains the first bodies of the first neurons. Axons of the first neurons go to the opposite side and form the ventral decussation of the tegmentum. You can see the crossing. And the axons descend and passes through pons, passes through medulla oblongata, and goes to the lateral funiculus of the spinal cord in front of lateral corticospinal tract. And the axons of the first neuron goes to the anterior horn. Anterior horn contains the bodies of the second neurons, motor neurons, and axons of the motor neurons form the anterior root, anterior roots, spinal nerves, and supply the muscles, skeletal muscles. Rubber spinal. The next, tectospinal. Tectospinal starts from the nuclei of the superior and inferior collicles. The axons, the first neurons are located here. The axons of the first neurons form the crossing, the dorsal decussation of the tegmentum, and descends. This tract passes through pons, medulla oblongata, and reaches the anterior funicle of the spinal cord, and the axons go laterally and reach the anterior horn. Anterior horn contains the nuclei of the motor nuclei, and the axons switch to the motor nuclei, the second neurons. Axons of the second neurons form the anterior roots, spinal nerves, and supply the muscles. The second tract, extrapyramidal. The next tract, the reticulospinal tract. Reticulospinal tract starts from the special nuclei of the reticular formation in the midbrain. The axons form the reticular formation, and as a part of the reticular formation, descends and reach the anterior and lateral funicle. The reticulospinal tract lies in the anterior and lateral funicles of the spinal cord, and the bodies of the second neurons are located in the anterior cord. And next,
there's some more.
Vestibulospinal. Vestibulospinal starts from the lateral vestibular nuclei. This tract descends and reaches the anterior and lateral funicles. It lies in front of reticular spinal tract here. Anterior and lateral, and the second neurons are located in the anterior horn of the spinal cord. The axons of the anterior, the axons of the second neurons form the anterior roots and spinal nerves and supply the muscles. And two tracts for cerebellum, I think. The cerebellar tracts, two tracts, descending tracts of the for cerebellum. The first tract between cortex and cerebellum. This tract is called cortico-pontocerebellar tract. Cortico-pontocerebellar tract starts from the old lobus of the brain, except the insula. Starts from the frontal, parietal, temporal, and occipital lobes. The part which starts from the temporal is called the temporopontina cerebellar tract. From frontal antenna cerebellar, accipita ponta cerebellar parts. From this tracts passes through capsula interna. Fronta cerebellar passes through anterior cross, accipita and parietal from the posterior cross. Passes through capsula interna and reaches the pons. Pons contains the proper nuclei of the pons. The axons of the first neurons switch to the nuclei of the proper nuclei of the pons. Switch to the bodies of the second neurons, the axons of the second neurons, pass through the via the middle cerebellar peduncle and finish at the level of the cortex of the cerebellum. My dear, this descending tract control the function of the cerebellum. The cortex can control the function of the cerebellum due to location of the corticopontocerebellar tract. And last tract, the cerebellum should control the movements of the muscles. And the cerebellum can control via nucleus ruber. And the cerebellum uses the nucleus ruber for control. The first neurons are located in the cortex of the cerebellum. The second neurons are located in the dental nuclei of the cerebellum. The axons of the second neurons pass through superior cerebellar peduncle and reach the nucleus ruber. And the third neurons are located in the nucleus ruber. The axons of the third neurons form the crossing and descends and form the rubrospinal tract. And the fourth neurons are located inside the anterior horn of the spinal cord. This tract is called the tractus cerebellar rubrospinalis. For control the movements of the muscle. That's all. Yes!